If you have PCOS, you've probably taken or considered taking a lot of supplements. But today we're going to be talking about one special one called Berberine. Is it safe? Does it actually work? Is it really nature's ozempic? Let's find out. Hi, I'm Dr. Kim Sommerville. I'm a medical doctor, clinical nutritionist, and health coach, and I help women manage their PCOS and manage your blood sugar. Today we're going to be talking about Berberine. What is it? How does it help PCOS? What are some of the side effects? And what are some of the interactions? And really, does it really work? So Berberine is a natural compound that is found in many plants, one being turmeric. Berberine itself has a very deep yellow color and was first used to dye clothing like wool and leather and even dye wood. But over time, it began to be used in Chinese medicine. Some of the things that Berberine would be used for would be heavy menstrual cramps, heavy bleeding, pain during delivery, and managing blood sugar. So it's no wonder that it actually segued into being a supplement for diabetes and PCOS as well. It has many properties like being anti-inflammatory, acting as an antibiotic, antifungal, antiviral. It really looks like it can be the biggest, best supplement out there. But what's the issue? Well, with Berberine, we found that there is just very limited amount of studies out there. But with the small studies we do have, here are some of the things that we have found that it may help when it comes to PCOS. We know that it really helps diabetes and PCOS by mainly managing insulin resistance. As most of you may know, the main cause of PCOS is insulin resistance, and that happens where the insulin does not regulate the blood sugar as well as it should. And when someone has PCOS, if that occurs, you find that the more insulin resistant you are, is the more that it affects your hormone balance. And that usually represents having high androgens or things called testosterone, which has a lot of symptoms that will either lead to having irregular periods, excess hair growth, acne, thinning of the hair on your scalp. So it is lovely if we could find something that helps insulin resistance and then helps a lot of the symptoms of PCOS. So Berberine helps with insulin resistance by increasing insulin production, reducing glucose production, and also reducing the absorption of glucose from the gut. But why is it called nature's ozempic? Well, ozempic is what we call a GLP-1 receptor agonist, which means that it stimulates insulin secretion and it actually helps to increase the amount of cells called pancreatic beta cells that produce insulin itself. So it's really a win-win here. Generally, what also happens with GLP-1 agonists is that it reduces your appetite. So over time, you find that you're not storing as much fat and you are lowering your calorie intake as well, which may lead to weight loss. I did a video about Metformin and how it could or couldn't help PCOS, so you can check that out right here. But when comparing Metformin to Berberine, a study with 100 women showed that Metformin and Berberine similarly reduced androgens like free testosterone and the free androgen index. So when there's a reduction in these, we usually should see that there is reduction in excess hair growth and acne as well, but sometimes those specific studies are not specific enough. But there is one study that noticed that when women with PCOS took Berberine for about 12 weeks, they found that their acne went from moderate to mild. So there is some hope there, but we're not too sure yet because the studies are not large enough to know. When we're talking about Berberine, especially as it relates to Metformin or inositol, we find that Berberine tends to be the one with the most side effects. You'll find that the side effects range from nausea, abdominal pain, constipation, diarrhea, vomiting, passing gas, and it may be harmful to those who are pregnant because it can pass the placental barrier between mom and baby. We don't want that. So just ensure that if you are pregnant or looking to get pregnant, Berberine is not one of the supplements that you generally, the dosage of Berberine can be as little as 400 milligrams and it can go as high as 1,500 milligrams. Just know that the higher you go with your dose is the likelier you are to get interactions or to get side effects from it. But of course, consult your doctor every time and make sure that whatever medications you're currently taking, you let your doctor know so we don't have any bad side effects from Berberine. There's a limited amount of studies about Berberine. I really haven't seen anything that Berberine interacts with badly, but just know that if you're taking Berberine with any other medication that can lower your blood sugar, it may get too low. Or if you're taking Berberine along with blood pressure medications like hypertension medications, it can also lower your blood pressure a little bit too low as well. So just be cautious, ensure that you're taking it separately, and speak to your doctor before starting. What do you think? Is Berberine really nature's Ozempic? We're not sure. If you search Berberine on TikTok or you search it on Google, you're going to find that a lot of people have told their stories about how Berberine helps them to either lose weight, reduce their PCOS symptoms, and to manage their blood sugar. But there really are just not enough studies to tell you that yes, this is the one for you. You're really going to have to talk to your doctor, talk to your nutritionist, do your research if you can, and find out if Berberine is going to be the PCOS supplement for you. And let me know, have you used Berberine before? How did it go? And if you're considering Berberine, let's talk about it in the comments. This is Simple Summer Naturals, giving you simple nutritional advice for your daily life. Take care.